Hey, welcome to the Answer Zone. We've got a bunch of questions to answer for you today. The first one's coming in from Susan. Her question is, how much gluten does it take to wipe out your villi? Simple answer with that one is we don't know exactly how much. What we do know is the average person that gets a celiac diagnosis, it takes anywhere from 10 to 30 years. It takes decades for most to get an accurate diagnosis. And in that process, the villi are being damaged the entire time. But to create, a total villus atrophy, nobody, I don't think, has ever really studied that in depth to any great degree. I would just simply say that one breadcrumb of gluten is enough to cause inflammation for as long as 2 months. And so the quicker you can figure out whether a gluten-free diet is right for you and get off of it, the better off you're going to be in the long run. I've been gluten-free for 15 years. All my blood tests come back saying I'm gluten-free, so no mess-ups. How come I'm still in pain daily? Every time I eat any food, my stomach hurts like it's celiac pain. A couple big reasons. Number one, you might be following a traditional gluten-free diet and still consuming other grains that are notoriously inflammatory and can cause damage to people with celiac diagnoses. One is corn, the other's rice, and the other's oat. I mean, those three are probably the three most common that people with celiac disease continue to eat when they're following a gluten-free diet. So I would encourage you to read No Grain, No Pain, because that book will go into the deep depths and details of why avoiding all grains may be necessary for you. The other thing, though, that you would want to ask your doctor to check out is whether or not you have an infection or an overgrowth of bacteria or fungus in your GI tract. Sometimes those types of problems when you eat, depending on what you're eating too, but when you eat, certain foods, particularly carbohydrates, can create flares if you have overgrowths and abnormal bacteria and fungus. And that can lead to the generation of different types of enterotoxins that can cause and drive leaky gut and subsequently chronic pain. So get with your doc and ask them to run that type of testing because there may be something going on there. Third thing, one more thing, check for nutritional deficiencies because gluten sensitivity, most of the people with gluten issues and celiac disease, even going gluten-free, a lot of people still have persistent nutritional deficiencies. Many of these nutrients are responsible for helping you heal and repair inflammation. So for example, omega-3 is a common deficiency in those with a history of celiac disease, vitamin D deficiency, vitamin C deficiency. And if you lack these nutrients, you may lack the ability to heal and repair your joints and to control that inflammation. So ask your doctor to check those as well. Diane wants to know, what 5 tips would you advise for somebody to help restore their health? Simple. Number 1, eat real food. Number 2, go to bed on time. Number 3, get exercise regularly. Number 4, go outside every day. And number 5, make sure that you're drinking plenty of water. Simple tips that you can live by. They're free to do, and they may just change the course or the direction of your health. Christine wants to know, how do you test for mold? So there's different ways to test for mold because there's different ways mold can present. So there's mold that you might have, like, for example, in your environment in your home. And then there's mold like a yeast overgrowth that you could have in your body. And then there's also mold allergy, which many people have. So let's clarify the different 3 ways that we would want to look at testing. If you're considering that you may have mold in your home, the best way, 2 ways to know. Number 1 is do a test called a mycotoxin test where you're measuring urine and you're looking at different types of mycotoxins that can be produced by environmental molds. If you have them in your urine, the likelihood that you have them in your home is very, very high. And if that's the case, then you want to hire a mold inspector to come out and do a deeper evaluation of whether or not your house has mold in it. Number 2, if you're talking about mold allergies, ask your doctor to measure you for IgE, IgG, IgA, and IgM antibodies against the different common molds, Aspergillus, Penicillium, Stachybotrys, etc. These are very easy tests that most doctors can run, very simple, and even insurance in some cases might cover it. Number 3, if we're talking about mold growing inside of you like a fungal or a candida overgrowth, one of the best things or best ways to do that is you can run antibodies against candida if you suspect it's a candida, so you can look at blood-borne antibodies. But you can also do a microbiome analysis, because a lot of times the mold growing in the body starts and is in its main hub is your gut, and so you can do a microbiome analysis of the gut to see if there's an imbalance of yeast or candida in the GI tract. So those are the primary ways that I would say go ask your doctor about and get tested. Let's see here, Leanne. What do you think the best maintenance herbs or natural remedies are for the disease that shall not be named? Look, my experience is, if you're still struggling, if you picked up, the common cold or COVID, the reality is, and if you're struggling still, even after you should have recovered, you're probably doing one of two things, not allowing your body to recover. Number 1, your diet's probably not good. This is what I see in a lot of cases, people that have the long COVID, is their diets are poor, and so when they get zapped by the infection, they just don't have any more juice nutritionally left in them, and so their bodies are just really struggling to make a full recovery. So one of the most important things you could do is have your nutrition levels checked and potentially supplement accordingly or eat differently. The other thing I commonly see when people have fantastic stellar diets, they get COVID and then they don't really fully recover, a lot of these people are in mold. Now, mold is a primary driver of immunosuppression and chronic inflammation, and so if you're struggling with long COVID and you're a healthy eater and your diet's clean and before it you were perfectly fine and healthy, then there's a very strong possibility that you might have mold in your home, and it's keeping you from fully being able to recover. Remember, it's an immunosuppressant and an inflammatory generating compound. So mold, produces mycotoxins that suppress your ability to heal and repair and that drive inflammatory damage through the body. So get tested for mold and mycotoxins. Let's see, Andrew says, I have high prolactin levels and would like to hear how you would go about reducing them. One of the most common things I see with people who come to me with gluten, I shouldn't say one of the most common, but I should say it's not uncommon. High prolactin can be caused by gluten. Gluten is known to cause something called polyendocrine syndrome, and one of the hormones that gluten can impact and elevate is prolactin. And I've seen a number of cases where people were actually able to lower their prolactin naturally by changing their diet and actually eventually even get off of their medications. So, you start with diet first, start with that gluten-free diet. I'll put a link below this video to a study on the impact that gluten can have on prolactin for you to read. Okay, Yvette wants to know, what can mold do to your health, both short-term and long-term? So if we're talking about environmental mold, in the short term, a lot of people will start to develop upper respiratory problems. So chronic cough, sore throat, fluid in the ears, watery, teary-itchy eyes, vision disturbances, so your vision might start deteriorating. Those are pretty common short-term symptoms. And then we get into the long-term stuff. With mold, chronically speaking, your body starts to age. It starts to progressively age. So a lot of people experience tremendous gastrointestinal problems, severe issues with sleep, neuropathy, burning tongue syndrome. These individuals will not tolerate supplements that help with detoxification. So supplements like glutathione and cysteine and methylated B vitamins, these people cannot tolerate them because of the mold. And then additionally, their bodies, because they're breaking down prematurely, a lot of aches and pains that are not explainable because there was no trauma. So just generalized aches, pains, fatigue, trouble sleeping, gastrointestinal symptoms, and intolerance to supplements. Those are more of your long-term consequences. Now, if we want to go late stage long-term, we're talking about very dangerous things like autoimmune disease and cancer. So if you suspect mold, get it checked out faster rather than later. It might save your life. So Dance wants to know, can gluten mold and poor nutrition be a cause for seizures? Simple answer, absolutely yes. Gluten, we know, is a neurotoxin. It can cause antibody production against the brain cells, and this can actually contribute to seizure disorder. We know there are a number of case reports and a number of research studies linking the connection between gluten exposure and seizure disorders. And of course, there are a number of different vitamins that are known to contribute to seizures, especially the B vitamins. So B vitamin deficiency can cause that as well. You had asked about the nutrition component. And then I think the other one was mold. As far as mold causing seizures, yes, mold is a neurotoxin as well. There was a federal case a number of years ago that proved that mold can cause neurological damage. In this federal case, they used high technology. It's an MRI computer technology called NeuroQuant, and they proved that mold actually causes nerve damage. And of course, seizures are a manifestation of nerve damage. So I would say yes to all three. I'll put a link below on gluten and seizure disorder so you can read more about that connection. Amanda's asking, why can I eat bread in Europe and not here in the US without getting bloated? Well, probably the reason is glyphosate. In the US, glyphosate is used twice on most grains, meaning they spray the crops twice before they're harvested and sent for processing. And so it's very possible that your exposure to glyphosate is altering your microbiome, changing your microbiome, making it harder for your natural gut bugs to help you digest your food. Remember, those good bacteria in your gut are very, very beneficial for us to be able to digest. And so when those are damaged, we can get, some of the symptoms can be bloating and indigestion. So that most likely is the reason why. You may not be gluten sensitive, but in my opinion, all humans should avoid glyphosate as much as possible. I would say the real test, Amanda, would be eat some organic grain here in the US, and if you're still getting bloated, then it's probably not the glyphosate so much as it's maybe a reaction to the species or the different types of grains that are grown here. A lot of ours are hybridized, and so they're harder to digest, whereas some of the grains grown in Europe are more heirloom grains that might be a little bit easier on your GI tract. So I would check those things out and see if that works for you. Okay, Mary is asking, my veterinarian's assistant told me that a grain-free diet for my cats was bad for them and that it caused heart disease and heart issues. Is there any truth in that? No. Cats are carnivorous. If we look at cats in the wild, they're scavengers, but predominantly they hunt and they eat meat. So grain is not basically on the food docket or on the menu for cats. It's actually a fantastic book written by Francis Pottinger. The name of the book is called Pottinger's Cats, and it was an expose, a research study, if you will, on three groups of cats. One group of cats was fed a carnivorous diet. Another group of cats was fed a processed kibble diet, and a third group was fed a mixture of processed and carnivorous. And he followed these cats for 3 generations and found that the processed cat food group ended up with mange, autoimmune problems, bone structure changes. The males started behaving like females. The females started behaving like males. I mean, it was a nightmare. They were infertile by the 3rd generation. The all carnivorous cat group did fantastic and had vibrant health. And the middle group, with the mixed processed and carnivorous diet, had the same problems, but just to a less degree as the all processed cat food diet. So I would say your veterinarian is trying to sell you processed cat food to make you think it's good for your cat. Now, disclosure, I'm not a vet, but I feed my animals raw meat, my dogs and my cats, and that's because that's what they're supposed to eat. So take with that what you will.